Dear Mr. President, I want to thank you for your heartfelt commitment to the health care of the American people. By way of introduction, I am Dr. Mary Zenit. I'm a physician for 23 years, and I work with people every day on working on ways to help them improve the quality of their health and lower their health care costs at the same time. Sir, I truly want to express my heartfelt thanks that this is the year for U.S. healthcare reform. Hearing from my patients, they believe that this is going to happen this year. And again, I truly thank you for this commitment. It's not a minute too soon that we reform healthcare. We know the problems, 47+ million uninsured Americans. And sir, many of my patients are not even able to afford their co-payments and deductibles. We're hearing more and more instances of where family members are needing to make very hard choices between paying for their health care or paying for their mortgage, their car payments, or even their gas. I wanted to take this moment to give you some insights from the people that I work with day in and day out. I hear a lot of things from people and truly wanted to take this minute to share them with you so that you could take their feedback into consideration in crafting a health reform proposal that will truly be meaningful, cost-effective, and health-effective for all Americans. One thing I hear from patients over and over is that the use of natural health products and services has been immeasurably helpful to them. Typically, we refer to this as complementary and alternative medicine. There are several problems with this, though. Sir, if a patient comes in needing to be hospitalized and they tell me that certain natural products and services work for them, and they ask me as their doctor to come up with a plan that would help support with medication a long-term health plan for them, I am not able, in many instances, to give them the natural health products and services. Now, why is that? Number one, our laws often prohibit it. The FDA claims, and states, this is a law, that no product or service that is not a prescription medicine can claim to cure, treat, or mitigate disease. Hence, in hospital formularies, these natural products and services are simply not available for patients, yet they are taking them on the outside. These laws came into being for a very good reason. Back in the era of the Great Depression, there was an era of snake oil being peddled to the American public. The laws that were designed were meant to protect the consumer. Today, the world is much more advanced scientifically. Natural health products and services are manufactured under the standards of the FDA called Good Manufacturing Practices. That means that these products are quality, insured, inspected, in many cases have incredible scientific research behind them. Yet, as a physician, I am bound by the laws that state that no natural product can claim to cure, treat, or mitigate disease. So that if I know of a quality natural health product or service that could be helpful, that has been researched, I cannot share this information with my patient. Now, if I'm in a private setting where all my patients would pay cash, yes, as a physician, I am free to tell them that. But sir, I work with patients in Middle America. My patients are either getting their health care reimbursed through Medicare, Medicaid, some private insurance, and in these instances, we are bound by the laws that say no natural product can claim to cure, treat, or mitigate a disease, even in conjunction with a medication. What I see in my practice, sir, is that the rates of chronic illnesses has skyrocketed. It is exponential. Patients that years ago you might have one person with an autoimmune disease, I can tell you, I know so many that I see every week who have some sort of chronic autoimmune condition. That might be fibromyalgia, chronic fatigue, lupus, rheumatoid arthritis. And sir, the patients are getting younger and younger. Years ago, these diseases used to be limited to people who were older. Now I'm seeing young people in their 20s, 30s, and 40s who are near paralyzed by these debilitating conditions. And from studying, researching, and collaborating with other doctors who are in practice in the community like I am seeing some real hope with the integration of quality natural products and services into the mainstream healthcare. But sir, our hands are tied. We are not allowed to offer these to our patients. We cannot say that any natural health product or service can claim to cure, treat, or mitigate a disease. And what's further, our patients can't afford them. Yet, as a physician, I am bound by the Hippocratic Oath. I am commissioned to do no harm. And if I know that a natural health product or service could be safer, possibly lower side effects of medication, I am bound by my oath to tell them this. Furthermore, the American Medical Association has a clause about informed consent. We physicians are obligated to give our patient the complete list of risks and benefits of every modality that we offer to our patients. So again, if I read some good quality research that says a natural product could help lower costs and be more safe and effective, I must tell this to my patient. But sir, I know you can appreciate the dilemma that a physician like myself is in mainstream clinical practice. Clearly, the laws need to change, and I believe it will be simpler. It may seem very overwhelming listening to all of it, but it really isn't. There are ways that we can shift and must shift this healthcare system from an illness industry to a wellness industry. It is estimated that 75% of chronic disease costs will be eliminated by the integration of natural health products and services into the mainstream healthcare. And sir, not a minute too soon. For the past 2 years, the Social Security trustees have given a Medicare fund alert. That means that if we do not curb chronic disease costs, there is a very strong risk that our Social Security reserves will be depleted by Medicare and chronic disease costs. Sir, there is so much to talk about, but in the interest of time, I want to take this moment to thank you for your commitment to health. Please know that we are here. We will be offering more specific suggestions to implement in the next days, weeks, and months ahead. And another thanks to you in this era of transparency that you have heralded. I have never in my wildest dreams thought that I would be able to communicate with the President of the United States via the power of the internet and technology. And sir, I express my heartfelt thanks to you. Let's follow up and transform this healthcare system now. Thank you.